record.
Okay.
Thank you. Yep. All right. So one thing that I wanted to share with you all is that public meeting laws have been updated, and you will see on the Oregon State Board of Nursing website, we have a page specifically for all of our public meeting rules. This is an updated statute. And so all of our meetings are under the public meeting law, and they will be recorded and posted to our website. So hence why they are being recorded. Any agencies, well, this meeting is specifically for all of the program directors, just like we have a meeting for deans and directors. They are also open to the public for people to listen in and hear. So today's public meeting, we'll have welcomes and introductions. We still have people joining. We will update on TMU and Headmaster, the year ahead. Meeting updates, I kind of shared one, but we'll continue to share kind of what we're thinking about how we host our meetings. Board updates, and then again, open forum discussion for as long as you all need to elevate issues. And next slide. So basically, and Selena, if you want to put in the chat, we're going to make sure that everybody, that you don't have to put your information in the chat. We're going to take down the slide so we can all see each other. But just really want the new policy analyst, Michelle Bell, to give the opportunity for you all to hear from her and do an introduction. And then for you all to give a brief introduction, your name, the program, the current role that you hold at the program, as well as just something interesting or exciting happening for your program or students. So you can take that slide down now that you've added that to the chat, Selena, so we can all see each other. I know we have 23 people. But I'm going to kick it off by having Michelle Bell introduce herself first. And then, you know, there may be some new people on here, so I will go as well. And then from there, we're going to have somebody go, and then we'll just popcorn to the next person. I think not everybody's camera is on. I encourage you to put your camera on if you are in a place that you can. If you can't, that's okay also. But I will call on you to do that brief introduction. The stuff is in the chat. But first, Rachel Prusak, Executive Director of the Board of Nursing. I know most of you. I also know that we do have a few new programs that have come live, so wanted to we've invited a few more people, given new programs being approved. Not sure if they're here yet, but I'm really excited to see you all had the month off. And I'm going to kick it over to Michelle Bell for her to do an introduction as the new policy analyst at the Oregon State Board of Nursing over NA and MA education. Go ahead, Michelle.
Thank you, Rachel. And good morning, everybody. I have been looking forward to this meeting. I am so excited to meet you all and hear your introductions here shortly. But a little bit about myself. Again, Michelle Bell. I'm a nurse. I'm a burn nurse by trade. So that was my bedside experience at the Oregon Bird Center. I've held a series of roles in perioperative and interventional services, behavioral health, as an infection prevention director, and most recently as a Senior Director of Clinical Excellence Research and Practice. I'm thrilled to join this OSBN team under the guidance of Rachel. I can't say enough how dynamic and engaged all of these individuals that I get to work with now are, and it's a pleasure. And I can't wait to bring that energy to the work that I'm going to be doing with all of you as well. So I look forward to our chat today. If at any time you have a question, please feel free to raise your hand. But if you can also sit on it, we'll have an open forum at the end, as Rachel mentioned, so we can really dig into anything that you've got on your mind today. And with that, I'll turn it over to Selena.
Good morning. Most of you know me already. I'm Selena Redbird. I was formerly Barbara Jou's assistant here at OSBN, and now I will be assisting Michelle in all things NAMA.
And we have Nicole joining us too, and to introduce herself, she is the administrative specialist that works with Selena. I'm having Nicole and Selena really learn from each other, and as they support their policy analysts. So,
You know why? Because
Hi, Nicole Van Winkle. Thank you.
oh, Heidi, I think Heidi Rose, your mic is off, or on rather. There you go. Go ahead, Nicole.
No worries. Hi, Nicole Van Winkle, Policy Coordinator and Administrative Assistant, and working and cross-training with Selena. Happy to be here. Thank you.
Great. And, Michelle, for ease, I'm just going to call on everyone's name to do the introduction because I can see the people list, and then you can focus on hearing and listening and taking notes to grasp everyone. All right. So we're around for that introduction of who you are, your program, your role in the program, as well as something exciting at the program that you're working through right now. But I'm going to go down my list, and Julie Butcher, go ahead first.
Well, okay. Good morning. I'm Julie Bucher. I'm the program director at Rise Partnership Long-Term Care Works. It is a union-based program. We work with SEIU facilities. And I guess the exciting thing that we're working on is expanding our program. And we're now offering classes across the state. So thank you.
Thanks, Julie. James Yale.
Good morning. My name is James Yale. I'm with Lane Community College here in Eugene, Oregon. I'm the program director for their nursing assistant program. Something exciting, I mean, you'll probably hear this a lot, but just looking to grow the program.
Awesome. Susan Craw.
Hi, I'm Susan Kahn, the Avamir's NA director, and in the position for a year. Sure, spending our Portland area.
We're having trouble with your hearing you, Susan. Your mic's going in and out.
Oh. Well, technology is great. So it's just expanding our program to Portland area.
Not just. That's huge. Thanks. Lisa Rye.
Good morning. I'm Lisa Rye. I'm the program director at Mount Hood Community College. And I think our exciting thing is I just had one of my English language learning classes finish, and the 4 to 5 people that have tested so far did amazing the first time, which is, not always the case. So really excited about that.
That's great, Lisa. Crystal Bowman.
Good morning. I'm Crystal Bowman. I'm the Dean of Nursing and Allied Health at Oregon Coast Community College. So I oversee nursing assistant, medical assistant, and EMT. The thing that we're focused on is my longtime lead faculty for NA, Lynn Barton, has retired after 20 years with the college. So I'm working on building our team back up again. We've hired a couple faculty that we're starting to train into the NA faculty roles. And then we've entered into a really cool partnership with Michelle Deese at Avamere in Newport to increase our enrollment and develop like a couple different cohorts of nursing assistants. So growing the program on the Central Oregon coast and getting more healthcare workers out there to the county because we need it.
Awesome. Thanks. And Heidi Rose.
Hi, I'm Heidi Rose. I'm the director of the NA program at Lynn Benton Community College. Something exciting for our program is that we're partnering with a couple local high schools to do a high school only class. And last year we did it, and we did it one time. We had one cohort, and this year we're going to have 2 cohorts. And so it's really exciting to get these high school students up and going.
That's fantastic. Thanks. Bradley Brown.
Hey everyone, my name is Bradley. I'm the program director for Marquee Company. We have a nursing assistant and a medication aided program. something exciting about our program is we actually just switched buildings from our Mount Tabor location to Piedmont. So it has been kind of a fun adjustment to find stuff that we put away in boxes and unpack everything.
That's great. Ann Newman.
Hi, good morning. My name is Anne, and I'm the program director for our Evergreen Healthcare Facilities. And something exciting is we just added a new building for one of our programs, and just I'm new to this role, so just learning what it entails in the future. Thank you.
Great, yeah. And Sandy Kellogg.
Hi, I'm Sandy Kellogg. I'm the Dean of Health Sciences here at Chemeketa Community College. So I have the BNA program, nursing, dental assisting, and pharmacy tech program. Something exciting here is we now are offering 2 cohorts a quarter for the BNA program. And I was surprised at they are full. So we're excited about that there are people that really want to come through the program, whereas a few years ago, we were struggling with filling our classes. So that's probably my news.
That's great. Carol Nice.
I'm Carol Nice, and I am the director and lead instructor at Dallas Retirement Village. Our classes have been growing. I started out in 2017 with 8 people. Then I went to 10 when we moved into the new building, and now I'm getting 12, and we have a CTA now, which is a lot of help for me. And we're just hoping to keep growing too.
Great. And then I see there's 2 people, but the name is Lynn Chase, Clackamas Nursing Assistant. So if you both want to introduce yourself.
Hi, I'm Lynn Chase, and this is my daughter, who is the office manager, Natalie, and Clackamas Nursing Assistant Training. And the exciting thing I have to share is that today is the 18th anniversary of the first day of the first class for this little business.
Wow. Happy anniversary.
Thank you.
Great. Let's see. Erin Honeycutt.
Hi, I'm Erin Honeycutt, and I am the program director for Volare Health. And we're a facility-based program. We have 11 facilities in Oregon, from Woodburn to Medford. And did I say also medication aid training and NA? And I think the biggest thing right now is trying to grow our medication aid training program.
That's great. We need more. Mara Pointer.
Good morning, everyone. Mara Pointer. I'm the Executive Director of Nursing and Allied Health for Treasure Valley Community College, way on the eastern side of Oregon. I am running our nursing kind of ladder. We have our ADN, an LPN to RN bridge, and our nursing assistant program. And then our allied health side, MA, our EMT. We're hopefully starting a surge tech program with our new building. Yay, come fall of 26. And for our NA program, we actually had 18 students this past summer, which was the largest collection we've had. And we're also using our hybrid platform to support our more rural communities. So we had students out of Burns, and then we've also been able to support our high schools locally. So a lot of growth going on here, but we're really excited, and hopefully more programs to come once that building opens. Thank you.
Great. Sherry? Oh, you're on mute.
Can you hear me now?
Yeah.
Okay, so I am the program director for Dare to Care. I have a program in Eugene and one in Lebanon. And I guess something exciting is I'm in the works of starting an online program. So
great. Thank you. Virginia Chambers.
Good morning. Virginia Chambers, I go by Vern. I'm the Director of Health Sciences here at Clackamas Community College. And so we have 7 different allied health programs that we support nursing assistants, one of them. I would say the exciting thing for nursing assistant right now is we just hired a new nursing assistant program director that will be starting October 15th. We've been running cohorts of 20 students per term and 10 in the summer, and it's been steady. We have quite a wait list right now for the program. So enrollment's been pretty strong, but I think most of the students that are applying and coming in are ones that want to get into nursing. And so I think that's kind of fueling it right now is the application process for nursing is open and people are trying to get more points right now. So.
Thank you. So I was able to call on everybody that had their camera on. I know some have turned them off since introducing themselves. And so I'm going to try to go up the list of people on the side that may have not already introduced themselves and have camera off. And I'm going to do my best. So Vicki Blanchard. How about this? Anybody that has their camera off, can you jump in or raise your hand so you can introduce yourself? Raising hand will be helpful so we don't all yell over each other. But that would be great. Okay, awesome, because then I see your name come up. Megan Phelps.
Good morning. My name is Megan Phelps. I am the program director for the Oregon Veterans Home in the Dalles. We have a NA and a MA course, and I'm looking forward to starting a new cohort next Tuesday that is completely full, which is sometimes hard for us to obtain. So that's it. Thank you.
That's great. Thanks. And Kelly Quinn?
Hi, I'm the program director for Rogue Community College Nursing Assistant Program. We have a couple exciting things going on. First of all, we're expanding our staffing because our classes are so full. So we're trying to hire more staff. And then we just got a new lab at one of our campuses. So that's nice as well.
Great, thanks. So I have Gray Star.
Oh, right. Okay, sorry. My name is Stella Kamau, Program Director of Grace Learning Institute. Something exciting is that this is our first NA program, and currently we are at a clinical site. So I'm super excited. Thank you.
Yeah, welcome. And here's your cohort of other colleagues and professionals to support you and grow with. And okay, Veronica Gutierrez.
Hi, this is Veronica Gutierrez. I'm from Regency Pacific Management Company. We have a nursing assistant training program. We're also trying to get the MA program up going. So Michelle, I'll be sending you my application and all the other paperwork that's needed. But this is great to have met you, and that's about it. Thank you.
Thank you. And then anybody else who hasn't gotten to introduce themselves yet? Good, there you go. Megan Mitchell, and then I think Vicki Blanchard.
Hi, good morning. I'm Megan Michelle. I'm the program director at Central Oregon Community College, and I'm looking forward to, we are building a new campus in Madras, and we'll be there this spring. And then we are also starting a new partnership with Madras High School to teach a class at their high school. So I'm trying to serve the rural, or getting an opportunity to serve some rural communities. We've also been inundated with requests from Culver High School and schools in Bend and in Craig County and Prineville that are all interested in nursing assistant programs. So we need some, I know Rachel knows that we've been working on, or trying to work on that long-term care requirement, and we could use some movement on that so that we can meet this demand.
Yeah, I think we could all use some movement on many things at the federal government level, but I don't see it happening anytime soon, unfortunately, but I look forward to when we get to do that as well. I think everyone in this group knows what we're talking about, but I had partnered with some community colleges, Oregon Healthcare Association, Hospital Association, other state agencies and Board of Nursing about how we remove the limiting, very antiquated kind of federal regulations and who can teach, who can train, and then even some of the things that keep us from being in certain clinics for old, minor violations that then keep us. So there's just so many little things that, and removing barriers, everything that we can do on a state level, we have been working to do, and we're always open to hear more. But unfortunately, it's just so much harder. But thank you for always elevating it. Every time we have a fight, we should never forget it, and every time we have the opportunity to elevate it. Okay, so anybody else?
Yes, good morning. This is Joan Eberling. I'm the Program Director for Pacific Healthcare Training in Southern Oregon.
Did you want to share anything exciting happening down there?
We're teaching more and more on the weekend. It's a little interesting that our weekend cohorts are very, very busy in compared to our weekday cohorts. So we are doing 2 classes a month, Monday through Friday schedule, and we're actually doing weekends now.
I love hearing it. All right, one more chance. Anyone else?
Hi,
Vicki,
I'm program director. My name is Vicki Blanchard. I'm program director with ARC Foundation. We also have just gone through a move from Newburgh to Sherwood, and we've been spending time like updating our equipment, providing new pieces that maybe they haven't seen before. And our students are doing better. Our numbers are coming up.
Great. All right, Michelle, I'm going to kick it back over to you. I am just so excited. I got to learn a little bit along with you as you're meeting them all. I have shared with everyone my first 2 years here. It was really hard for me to get to these meetings, but moving into my 3rd year, I'm just excited more and more to dig into the work that you all are doing across the state. And as we just all heard, it is a lot of work. It's big work. It is supporting the workforce throughout our state of really important staff. So thank you for taking the opportunity to introduce yourself and for all the work that you're doing. And I'll kick it back over to Michelle.
Yeah, well said, Rachel. And what a pleasure to meet you all, put some faces to those of you that we've communicated with digitally. And wow, so much growth energy out there. That is very exciting. I'm gonna actually let me know when you see my presentation.
Okay.
It's taking its time. You can do it.
We see it.
Perfect. Let me get back to our spot. All right. So TMU, I know there was a lot of work done before Barbara left her position to really try and get us transitioned over from Advera to the TMU system. And I want to thank you all for your patience as we work through some of these initial adjustments as we actually start using the platform. We've been really working in the background, even in the short time I've been here, to optimize our process, particularly for faculty and site applications. And our TMU associates have absolutely been engaged and responsive partners. So I know that we will be able to dial this in short notice. So again, thank you. And your feedback is so critical to this work. So, if you're running into a challenge, if there's an issue, please continue to reach out to us so we can address those and maybe build a better product for all of our end users. I do want to say a reminder, we don't handle student accounts directly. Those go through OSBN licensing, Yolanda and her peers. So really, we're talking mostly about the faculty program and site applications that Selena and I are really working to process in a timely fashion for you all. So yeah, I think that we have a lot of work to continue to do in this space, but the progress is happening really quickly. So thank you. This is the new site for all things, so no more Advera. And it'll be, I think, a really lovely product when we have it all dialed in and you all are comfortable using it and we're comfortable on our end as well. So looking ahead at the next year for OSBN and what are we doing for our NA and MA programs as you are all out there in the world growing your programs and that workforce that we so desperately need. And I want to really break it down in a simple kind of thought experiment for how we move forward. And I encourage you to also take these questions away from this meeting and consider, because this is where I'm really living in this space. I want you to also really consider in this space so that we can create a program where we're easing your way, and everything we're doing is really meaningful and efficient and streamlined. So what should we continue doing? What are we doing well that we should really keep doing the way we're doing it? Are there things that we should stop doing? Are there things that maybe we have inherited? There's pieces of work or expectations that are historical. We've just always done it that way. Maybe we don't need to do it that way. Maybe we're asking too much of you in certain spaces. And then what are we missing that we should be doing? Do we have blind spots? Are there pieces of work or support that we at OSBN could begin doing that would ease your way on that front end as well? So I encourage you to reflect on these questions as well. If you have ideas, please shoot them my way. Because I've been called a deconstructionist previously, but I like to really make sure that the program we're running is the right work and the right work for all of us. Some updates to our meeting schedule. So I think that this is something that's been brought up to this group before with Rachel and Laura Blackhurst, who is my OPA peer in the nursing education world, but really working to cross-train and align a lot of the work that we're doing. So we really have a deeper bench to support you all truly, and vice versa for her work. So we are working to align with the nursing education schedule and cadence. They do a similar meeting for the deans and directors in nursing, and that's quarterly. So at least for the beginning, first half of 2026, we are moving this meeting to a quarterly cadence. We're pushing it back from the first Wednesday to the second Wednesday. That's true for January 14th and April 8th. July 15th is actually the third Wednesday, but that's due to the holiday. And that'll align again with that nursing schedule. And then pushing it back from 9 to 10 again to kind of line up. So hopefully that doesn't cause anybody significant heartburn.
Yeah, and I'll add, Michelle, I know you all have been in a monthly schedule for a really long time, as the last year with Laura Blackhurst in the role of nursing education, and now Michelle in the role. A lot of the work that we're doing is, as she mentioned, to be able to support each other as a team versus this one policy analyst meets with this group. How do they support each other? One of the things that I have looked at over the past year is how many surveys Barbara Zhu had to do, because there's so many more NA and MA programs than there are RN programs. And then we have somebody dedicated to APRN, and that's very few programs. So how do they all who understand survey, how do they all who understand supporting those in the education world of nursing, whether it's CNA, RN, APRN, be able to support each other as policy analysts to support you all better? And so making sure they can come to each other's meetings, support each other, understand it. Now, if you all want to reevaluate next year in 2026, Michelle can reevaluate with you all. Do you not? Does it not work for the NA programs to do quarterly meetings the way the RN programs have always done it? Again, if you miss a meeting, they are now within public meeting laws. They are now all being recorded. They will now all be on our website. And so therefore, we all want you all to prioritize them as much as possible, but understand if you can't go, they'll be recorded for you to see the kind of AI transcription as well as the recording. I think that's all I had to add on that. And we'll make sure you get the meeting invite from Selena so that it's all in your busy calendars as soon as possible. All right. So would you mind just taking this slide down while I talk to the group about this so I can see you all? So I just wanted to give some board updates. I don't know if anybody was able to watch the board meeting but it was extensive. The way that you all did work with Barbara Zhu for an extensive year on the 61 and 62 and combining CNAs, well, that work was kind of done by looking at our statutes of the last 70 years, the patchwork that occurs from any law that is passed that kind of impacts the NPA. And we combed through those for a year. We went to the legislature, House Bill 3044. We asked for updates, and all of these updates were to modernize, align, and improve customer service, and our customers being the nurses that we license and the public that we protect. So this crossed 90 rules and 11 divisions. It is not anything that is going to, you all need to know the intricacies of it right now, like you did when we did the CNA consolidation, because as I said, it's mostly updating language. We had antiquated language, modernizing. Sometimes we had contradictory information. So we brought it to the board at the September meeting. I'd say the biggest discussions, I'll highlight high level what they were. I've been highlighting the top 3 that I think we should start planting the seed of what is important moving forward. And then I'm going to turn the meeting back over to Michelle and hop to join another meeting that I have to join. But really, the big things that the board kind of had public discussion and debate around was around there's a concept that late renewals are practicing without a license. That's discipline at 30 days. So if somebody forgets to renew any of their certificate or license, the threshold for meeting discipline has been 30 days historically. I wanted to start the conversation of moving that to 90 days after doing a national survey. Some states are day 1, 30 days, 60 days, 90 days, 6 months, 1 year. So I proposed 90 days. There was some discussion around that. With a dissenting vote, it still moved forward. We are in the rule hearing process up until October 21st. Anybody can write into the public supporting or opposing. And then the rule hearing is on actually October 1st if somebody wanted to give public testimony. It goes back to the board in November. The other big thing was around CEs. 93% of jurisdictions of nurses. I know this meeting is much more NA and MA, but I know a lot of you are also involved in nursing and nurses yourself. 93% of jurisdictions across the state follow a CE model. Our statutes follow a CE model. Our rules we're following practice hours. We are updating that. There was a lot of conversation around that because any change is change. But again, it was a very antiquated practice in Oregon to still do this. What I found when I arrived, just like I was seeing kind of like an issue with renewals and did the reminders, the 30, 60, 90-day reminders. So we're seeing less of the late renewals or quote unquote practicing without a license. But the other thing that I saw was really around someone taking time off to care for their loved one, somebody having a child, whatever reason. If you take 2 years off, all of a sudden we don't have our critical thinking skills and we needed to do a reentry program. No, we needed to move to a CE model. And that's what the board voted on. So that will start January 2026. Again, there were some dissenting votes and interesting discussion around that. So if anybody here is interested in testimony for that, the public hearing time is open till October 21st at the end of the day. You send any of us an email and or show up on October 21st, and that information has been posted to our website, as well as will get sent out in October newsletter this week. I think those are the top 2 that I'll highlight. But again, rule hearing time is open. November goes back to the board, takes effect January. So any high-level questions on that? We also held our board meeting on the coast after holding one in Southern Oregon. It was really great to be away from the office, outside of the Portland metro area, and be with the community. And we'll be back at the office in November. And of course, you are all welcome to join us. Sandy.
Yeah, I just put in the chat. So when you were talking about the late renewals, that is regarding all licensures. Okay.
Yes. Yeah.
I just want to clarify.
Yep. Thank you for the clarifying question. Lisa Rye.
Is it just renewing late, or is it actually they were working?
So, well, that's the great question. So renewing late, you get your $100 fine 1 second past midnight. I had to I've gotten my 90-day and my 60-day renewal reminder. I'm waiting for my 30-day and then I'll go and do it. I'm one of those. But it's what if you're practicing? Yep. If you just late renew, you pay the renewal fee. But if you mention you're practicing and for example, you all have somebody working, you realize their CNA, RN, anything had expired, you need to say you need to stop working and you need to take care of this. Any amount of time between those days, if it was anything beyond 30, went to the investigation department. And so I'll just share, I've been very transparent about this, not just the Board of Nursing, but all regulatory boards in the state of Oregon, as well as all boards of nursing across the nation are receiving more complaints than we've ever received ever. People are unhappy with our healthcare system. They complain. We're statutorily authorized to investigate almost everything that comes in. And therefore, our investigation department is really busy. And there are some really serious things, and I want to make sure we're not tying them up with potentially ones that are, no harm has been done. That was the goal of that. And Sandy, do you have another question? Okay. All right, so those are the big board updates. Again, nothing specific CNA. I just wanted to give a high level that there was a huge body of work done to continue the work we've been doing over the last 2 years to modernize, remove barriers, and improve our customer service to all of you on the call. I'll kick it back over to you, Michelle, unless there's anything you want to add.
That's great. I think, Rachel, there's been some discussion about, the OARs that are specifically looking at our rules around NA and MA programs. And that wasn't really tackled in this last big body of work, right? And so what's our timeline?
No, that's going to be your big body of work that you can talk about now if you'd like, high level. I know you kind of already did, but I do think maybe a little bit more is to say, we know, as was mentioned earlier, there is a lot of federal regulation overlay to the NA programs, which complicates it more than any other program. You all have really hard jobs. And with that, many boards of nursing don't take on the responsibility of NA programs because of that. It is DHS, right? For example, it is a different department agency. But those of us at the Board of Nursing who do own it, we know that we will do it better than any other agency because we care deeply about this and we want to continue that. But we also know that we have to take the time, just like Laura Blackhurst did with Division 21, and comb through. I know some of you on this call, Sandy Kellogg in particular, who also are engaged in RN programs. This was a year-long plus of work, so just like you all did in the CNA work, but in the RN education division of 21, to do all the same things: modernize, improve, remove barriers, and improve our customer service. So that really does need to happen, and that is Michelle's #1 goal over the next year, and I'm sure you all will be hearing about that, how she takes the federal regulations with our statutes and say, where do we need to reconcile this? Where do we need to improve it to make everybody's work the best that it can be? I don't know if you want to say anything else to that, Michelle.
That was really well said, Rachel. And I think my goal, and I know the goal of the board, as I mentioned earlier, is absolutely to ease your way and look carefully at all the layers that we have created and some of the nuance and again, make sure that the work that we're doing and that we're asking you all to do is really guided by that framework of federal regulation and our own statutes, and then looking at those rules and asking ourselves, are we creating barriers? And if so, that's what we want to address, so we want to remove.
Yeah, and I think that just nails it home of like, and Crystal, I know you were involved in the nursing education one too. Where did we create barriers in our rules, or where are we hopefully making sure that we are following everything that we're supposed to on the federal side? So thank you in advance as we kick off that big body of work moving into next year.
Thanks, Rachel.
Mm-hmm.
And with that, that's it. That's what we brought for you all. So I want to turn it over to the group. I know in the past, I understand this is more of an informal, open forum. And so what questions do you have? Hot topics, things you want to ask each other, us? Turn it over to y'all.
Yeah, and then I'm sorry, Michelle, I forgot that I do have the Governor's Task Force Behavioral Health Talent Council that I'm going to jump to. If there's any question that Michelle, Selena, Nicole cannot answer, this is recorded, it will be transcribed, we will follow up with you. We never pretend to know everything, but we'll try our best to get the answer to you. So it was really good to see you all. I'm really excited about the work ahead with Michelle. And I know that Barbara is enjoying her retirement. I feel like we all sent her off well. She was very thankful for the work she did at the board at the end of her career with all of you, and we had extensive conversations about that. Anybody who was in the office on her last day, we clapped her as she walked out. Her and Michelle got to work closely together all day for 2 weeks. So I'm really happy about that transition and the work ahead. So I will see you all next time. Take care. And Michelle, again, any questions that you can't answer, just you and I can meet and I'll get back to y'all.
Sounds great. Okay. Thank you so much for joining us, Rachel.
Yeah, bye.
Thanks, Rachel.
And to her point, I recognize I've got big shoes to fill. I'm following Barbara Jew. But Crystal Bowman.
Yes, thank you. I know for me, personally, one thing that I would love to see talked about and maybe changed is the somewhat strict requirement for nursing assistant faculty. We know that we have such a need for nursing faculty, nursing assistant faculty, and I have been unable to expand my nursing assistant cohort simply because of faculty. So there's been this lack of understanding why a perfectly trained critical care nurse, burn nurse like yourself can't step in and teach a nursing assistant program when they're more than qualified simply because they've never stepped foot in long-term care or worked within a CNA program. So I feel like that's something that we should talk about just for more flexibility in hiring faculty within the nursing assistant programs. I think it would be a positive change and we could move cohorts in a better direction and increase them, at least on the coast.
Thank you so much for bringing that up, Crystal. And I want to be cautious in how we approach this because there is a federal regulation, right? But where I think we have an opportunity is how we're interpreting that long-term care facility. You know, again, us all being nurses, I can look at a resume and know when somebody has, for example, you know, worked with CNAs or provide education, even if they didn't have the title of educator, as an example. So I have my own way of reviewing those applications and my own lens of understanding that I'll be putting those through. And so I agree. And I think we don't want to throw the baby out with the bathwater in how we are reviewing some of those applications. So I look forward to working with you all in easing that way as much as we can with that federal reg kind of looming over our shoulder until we can get that fixed. Yeah.
Thank you. I appreciate it.
Yeah. Heidi Rose.
Hi, maybe this isn't the correct forum to ask this, but I was wondering if anyone has any updates on the videos that we used to use in the skills setting that we no longer have access to.
I'm not familiar with what those are, so if any of you all know, just don't raise a hand, just answer.
No,
Okay.
no worries. Wrong forum.
No,
Yeah,
that's okay.
somebody was creating them, and then they were going to make them available to all of us, but I can't remember what program director was doing it.
And I thought they were working with Barbara Jew.
And this was like, what, 6 months ago, maybe?
Yeah.
Yeah.
So Mount Hood Community College is going to do it, but they aren't going to start till like now. So it's going to be a while, you know, but we have worked with our, you know, integrated media, and they're going to set it up and record them for us. So it's just going to be time.
So these are instructional videos
But they'll
that
be
you
there
are
eventually.
creating for educational
State test skill videos that used to be, yeah, Headmaster had some state skills videos, but they became outdated and they weren't supported by some other programs and things, you know, like different options for like closed captioning and other things. They couldn't do the same that you would like them to do. So they just took them off because they were going to sell them, but then they didn't. And then they just said they're not going to update them, and they just removed them. So Mountain Hood Community College is going to work on with our integrated media department to get new skill videos.
And I see Julie Booker is using the Hartman videos. The chat.
Oh, that's good information. Thank you.
We use the Hartman videos too, and they seem to be well, you know, received by the students.
Awesome.
Mara Pointner, I think I skipped over your hand. I apologize.
Oh, no problem. It's Mara Pointer. So being kind of on this eastern border, we've kind of had some issues with Headmaster and supplying a tester for us, because as of right now, we only have one. And last summer she was ill, so for almost 6 months we couldn't get anyone tested. And we put out a ton of blast as far as if anyone was interested, but the fact that you have to have your own kind of business and then Headmaster runs it through, that has not really gone over well with our community. We have not had, I don't think, anyone apply over this last year. So I'm just hoping that we can figure out a way to support this eastern border. Thankfully, we have this one tester. However, that's the only one that we have that's active. So I don't know if we could figure out a way to encourage more of the western side to come over to support us, or if we could somehow figure out a better method to have perhaps a backup. Otherwise, we're not testing. And our students have to travel over to the west side of Oregon to finish any of their skills and what have you.
Yeah, that's a barrier we shouldn't have for them. I'm sorry to hear that. I will reach out to TMU. We meet with them. Selena and I are meeting with them every other week, mostly to focus on, again, like fine tuning the software, since we didn't really beta test it before it went live. But that's something I'll absolutely bring to that group and say, we need to solve for this. That's not okay. And if it's, you know, the word is out and folks don't want to go through the program because that is a barrier, that's significant.
Thank you.
Megan?
I was going to say, just for the federal long-term care requirement, I would encourage anyone who would love to see some movement on that. Also, reach out to your representatives. That's going to be super helpful. I think, especially I did have talked with some folks from Bynum's office, as well as Merkley and Wyden's in the past. If anyone is in Bence's or any of the other representatives, if you're in their district, reaching out to them and just say that we need support and would like to take this to Medicare and Medicaid to get a change get change through CMS. So thanks.
Absolutely. Keep beating that drum. What else? All questions for me, questions for each other. This is our moment until January. So take advantage. Aaron.
I was just gonna respond to Mara's comment. I feel like I feel like it's been harder lately, like in the last probably year, to find testers. Even in a, we're in like the, hot area, and it's been, hard. I don't know if anybody else has had that issue. Um, but so we never have to wait 6 months. I mean, that's crazy, but we do have had to wait, a while, and it just seems like it's gotten worse. And so I don't know if it's just we don't have the testers or what the deal is. I just wanted to point that out, that it's kind of across, for us anyway, it's been an issue trying to find test dates and stuff. I feel like Julie's has something to say. She's Have you had the same issue?
With Headmaster?
Yeah.
No.
Okay.
No, what I wanted to tell you guys was we used the Mosby's textbook, but I found that, I really needed some skills videos. So what I did, my workaround was to contact Hartman and ask them if we use your workbook, then we could have access to the videos. So we actually use, it's kind of weird, I know, but the Mosby's textbook is an amazing textbook. It's very good. But when you use a workbook that matches the textbook, it really doesn't embed thoroughly, to my mind, those critical thinking skills. So part of study skills and part of learning the process of everything that we're teaching them is to learn how to find that information. So when you write a chapter for a textbook, if you should do that on infection control, there's not a lot of ways to deviate from what we're teaching. It's like writing a chapter on the cardiac system. There's still 4 chambers in the heart. There's 2 valves, the veins, the arteries, it doesn't change, right? So you have this sort of set template of what you're teaching. So even though the chapters in the Hartman workbook don't match the chapters in the Mosby's textbook, it forces the students to look for that information. And so if chapter 16 is infection control in the Mosby's textbook, but chapter, I don't know what it is, 9, or I'm just throwing out an example, in the Hartman book, I always tell my students, you're going to have to search for this information. But isn't that part of the job anyway? So if you don't know, as a nurse, right? I'm an old nurse. I've been around for over 40 years doing this nursing thing, 20 years in program director and teaching. As a nurse, if you don't know how to use a piece of equipment, what do? You go get the information sheet and you read how to use the piece of equipment, or you go talk to somebody who knows how to use that. So you get a mentor or a person to show you how to do that. So finding that information, I think, is really important. It's also holds true for vocabulary words. So we teach a lot of vocab words, but they need to find that information. So the beauty of what we've done is we're using a workbook for a different textbook, but that opens the door for the skills videos. And then we're using the textbook for the program, the Mosby's textbook. So just wanted to tell you guys how crazy my mind is and how I did that workaround to get access to those skills videos. And by the way, the Hartman videos are amazing and excellent and perfect for Oregon.
Great. They recently reached out because they heard we had some updates to the curriculum that went into effect in July, and they want to make sure that their texts that they're publishing are staying aligned and serving all of their communities. So they're taking a close look at that to make sure that anything in the future coming out will continue to be meaningful for Oregon. Crazy, brilliant, Julie, they go hand in hand, right? Bradley.
Hey, so I was just curious, do any of the programs, do you guys do a skills final? We just started implementing we have a written final, and then we just started doing a skills final. And I was just curious if you guys do one and if I'm able to pick your brain a little afterwards on what you found to be helpful.
I see Lisa and James will have a hand up. Lisa?
Yeah, we do, and it really works well. It gives it like at least gets them thinking it's a completely different thing to do a skills test, and it gives them an opportunity to kind of be aware of it. Uh, and we do it based on you have to get at least 80% of the steps correct. They generally get way more than that, but because we're not supposed to know and we're not supposed to say what the weighted steps are, we just say 80%. So in theory, somebody could pass the skills test but completely botch the blood pressure numbers. But then we make a point to say, yeah, but guess what? This is important, so we do it. We give them like 40 minutes and 3 skills. We do one of the mandatory skills, one of the vital signs skills, and then one of the others each time. And they generally get done in under a half hour. But we also talk about time when they're doing it too, and how that applies to what they're doing otherwise.
Okay, cool. Thank you.
Yeah. I could send you the policy we use.
Oh yeah, if you can, that'd be awesome. Thank you.
And Megan?
We also do one similar to that. We structure just like headmaster with 35 minutes and 3 skills. We do let them know that they could do 3 or 4 skills with headmaster. And we also, before we head to clinical, we do what we call preclinical skills evaluation, where they have to demonstrate 2 skills in 25 minutes, just so like for kind of positioning, transfers, vitals, some things in the big 5. We want to make sure that they are and have that minimum competency before heading in to work with the actual people. So yeah, with those 2, that has been helpful.
Cool. Thank you.
Aaron?
Yes, I had a question for you, Michelle, about the renewal. The NA and MA renewal. We're due for ours now, and I sent all the information in. I just didn't know if you were going to eventually get to that, or if, what the timeline was on that, or that kind of thing, or if you're really backed up, or.
Yeah, no, that's a great question. And thanks for bringing it up, Aaron. And I apologize if I haven't been in touch with you yet. There is a handful of programs I'm reaching out one-to-one to connect with who are either due currently, slightly overdue, or coming due before the end of this year. I did go to the board and ask for a 6-month extension. Truly, to be able to learn this role, there are a lot of tentacles, a lot of pieces, a lot of complexities that I think you all understand.
Yes.
And even the survey process itself. I think Barbara Jew had a process that worked really well for her, but the tools that are going to work for me to be able to support you might need to look a little bit different. And so that's the space I'm really working in. And again, like we mentioned, really cutting through those layers of all the things we're asking from you, for every renewal. It's quite a lot. And some of the information, I'm not sure. I'll just leave it at that. So
okay, yeah, that's perfect.
Yes, and so if you haven't heard from me, you'll be getting a letter soon. I think there were 9 programs total, but 2 of the programs are NAMA combined. And then hofully, even though I asked for the extension through the end of Q1 of 2026, I don't hope to use that time. It's just a buffer as I kind of get my feet under me and make sure that we're doing what needs to be done and not asking too much to overburden you all as well.
Exactly. Thank you so much.
Yeah, great question. So, I mean, during your introductions, I hear so many programs saying that they're growing or that their cohorts are full, they've got waiting lists. That's really exciting. I know there's 2 new program applications in the queue that Selena and I are looking at to try and get them through that approval process. So that's great. But what are the barriers for significant barriers? I'm curious for continued expansion of your programs. I've heard, the faculty qualifications is a challenge. I'm hearing potentially the availability of testers is a challenge. What else, James?
From my perspective, the biggest challenge has been not just the hiring of individuals, it's the ratios in which we can have the classes and when we need support. Because financially, I think from most college perspectives, a 1-to-10 ratio outside of the classroom, even when we go back to the skills lab component, can be burdensome. I mean, especially when you're looking at 2 RNs that you're paying to do that job. I mean, I know it crosses domains where it's faculty recruitment and pieces like that too. But even using, an LPN can be very difficult. So that's what I see as my greatest barrier to expanding my program. I'll be honest, my summer cohort had 115 people on my wait list. So,
Wow.
I mean, and a lot of those barriers are, I just can't get faculty in at an RN level all the time.
So we're all RNs here. And this is just curiosity and an open forum. I'm processing out loud. It's a process with me. Why could a CNA not teach CNAs?
You have to do.
I love that you say
above.
that, because that is exactly my point of contention with this is, why couldn't a CNA support me? I mean, I don't even need a CNA to teach the course, but why couldn't they support me in the instruction of the course? And that's actually been something I raised to Barbara in the past.
Like as a CTA role?
Yes, ma'am.
Aaron?
Oh, well, 2 things. I was gonna, the other would be medication aid. If we could have, I don't see why we couldn't have a medication aid teach them, or, clinical support, or for clinicals, because they're the ones that do the, medication passing, and we have to have an LPN or RN that doesn't even do, anyway, so just want to put that out there. But for me, the biggest thing as a facility-based program is the prohibition letters. Those are very, those are the biggest barrier for us, because, we lose a facility, then we have to either cancel the classes or switch to another facility. And we do have 11, but they're spread out. And so it can be, that's just our biggest barrier.
Yeah. And that's a space where I'm really trying to learn what the expectations are. It's a complicated kind of oversight between us and Oregon DHS and, a federal contract for looking at that. And I think we have some opportunities to make sure that the information we're sharing with you is the most up to date. But my understanding is if that prohibition comes in, or the finding comes in, and the prohibition notice is given, that any cohorts that are in place should be able to continue, right? That shouldn't disrupt current cohorts. It would affect future cohorts. So, I mean, regardless, it's still a barrier, but.
Well, cancel, yeah, and I meant cancel classes as in cancel upcoming, because, we recruit in advance. So.
Yeah, and you heard Rachel saying that, she's advocating for at that federal level, trying to review what we're doing in that space, because sometimes it does feel like the punishment doesn't fit the offense, if you will. Julie. Oh, you're muted.
Thank you. I take one down and then I'm okay. Anyway, I just wanted to mention that, you know, I just said, you guys, I've been doing this for about 20 years. So back in the day, and I think Carol Nice and Lynn Chase will probably remember this, we didn't have a ratio of how many students to instructors. And so in my program that I was teaching in back then, which is closed and been gone for years, what we did was we had the size of the classroom dictated to us how large, how many students we would put in there. And one instructor would do 15 or maybe even 18 students in labs. But then what we did was we brought in a second instructor for the last day or two of labs to help sign off skills. And so I'm accustomed to being able to teach maybe 15, 16 students in labs. It does take some talent, but it's, you know, I mean, again, we have to kind of think outside the box. So, you know, I'm not advocating for more than 10 in clinicals. I think that 10 in clinicals is difficult. I think in some of the smaller facilities, you can only put 6 or 7 students into a clinical if the facility only has maybe 40 beds or you know, they're around that size. You can't put 10 students into a facility that has 40 beds, you know, in a clinical. But in labs, a lot of us are seasoned instructors, and I'm sure that a lot of the younger, newer instructors can gain those skills to be able to do labs without a 1 to 10 ratio. Um, you know, I mean, 1 to 11, I put this in the chat, 2 nurses for 11 students does not make sense financially. It absolutely is a deal breaker for a lot of our programs. Um, so if we could look at that, then we could increase the sizes of the classes without having to increase, you know, the faculty count. And then we would break, maybe we put 15 or 16 students for one instructor for labs, and then break those into 2 clinical groups. You know, there's 8 in a clinical. So that's just a suggestion I have on how to reduce that barrier, um, you know, for the 1 to 10 in labs.
And I see Megan in the chat saying they don't enroll over 10 unless they hit the threshold of 15. Carol?
One of the things that we have just started doing in the last couple of weeks is having preceptor programs, so that anybody who wanted to be a preceptor in the facility could apply and then go through a workshop, and so that they could learn exactly what the students are learning and how they're doing the skills and what the expectations are. So that's how we're supporting the clinical process for the instructor.
And that's a workshop your program is putting on, providing for them?
Yes. We invite them to lunch even.
And Megan? Oh, did you not have your hand up, Megan? Michelle? Megan, Michelle? Okay. Virginia?
Yeah, I was just curious when it comes to the instructor to student ratio and the meaningful education and training that goes with that. So I'm just curious on what, because I do understand the 1 to 10. For lab, we do 2 to 10 for lab, and we actually do 6 students per 1 faculty for our clinicals. And the amount of feedback, it's amazing, not just from the employers, but from the students. And it's really created a really wonderful environment. So I'm curious, do most facilities do 1 to 10, or is that usually what everybody does for their labs, is a 1 to 10? Interesting. Okay. Okay, thank you.
Bradley?
Just a quick question that just kind of popped in my mind, and I know this is something that's not going to be easily, but for Mara, I was thinking about this. So how come federal guidelines say that for headmaster, it has to be an RN to do the skills checkoff list for state testing? Would it be easier and reduce the barriers if it was like an LPN? Because an LPN could be there for clinicals. So what would be the difference between an LPN watching someone in clinicals versus LPN for the state testing, especially for those rural areas? I don't know, that was just something that just popped in my mind. And I don't know if that would help reduce barriers for testing or not.
I appreciate that. I think we have even less LPNs here than we do RNs. And I think at the legal level, when we think about assuming responsibility, the RN's at the top of the food chain. And so in my opinion, it should still be an RN for a tester, because they're the ones signing off on the skill set, whether that's the PN underneath them or the LPN underneath them or the CNA. So it feels like they should be if they're the ones signing off on the skill, because we're ultimately liable legally, then they should be the ones testing as well.
Fair.
But thank you for that. I appreciate that, Bradley.
That makes sense to me as well, Mara. Lisa?
Although I have to point out when the headmaster says their instructions, they exactly say the test observer does not decide whether you pass or fail. Headmaster staff in Montana decide whether you pass or fail. So having it be an LPN really wouldn't mean that it's not being assessed, or the LPN's not assessing, they're marking the list, which is absolutely always in the list of things that an LPN can do. But because I think it could be a good way to have more test observers as well.
It's an interesting point you make, Lisa, because in our statute, it says the OPA 4 is the final decision maker, which is interesting to me because headmaster is sending me the results of all of their investigations if a student kind of challenges their test results. But I wasn't there. I'm not the one conducting the investigation. I can't imagine a scenario in which I would say, I'm going to decide against the investigation that you have performed. So there is a kind of an interesting chain of authority there for that test that I think needs to be explored and considered, to your point. Great discussion, guys. What else? I'm hearing barriers are the ability to get staff, and contributing to that are sort of minimum staffing ratios, the roles required to fill these positions, particularly RNs, availability of testers. What else? Megan?
I think another barrier just with staffing is the disparity in pay between the industry and education is huge. Yeah, that'd be amazing to get more support at the state level for nursing, for educators across the board in all fields. So
yeah, I mean that topic is so much broader than this group, right? Like that is a universal perception that issue exists, and I can tell you that just in my short time with the Board of Nursing, you have some fantastic advocates for our educators and the idea of pay being a barrier. Yeah. That's great, you guys. What are some things that maybe I need to know walking into this role that you think I need to know or are important to know or understand about the work that you're doing? Julie?
Yeah, I have a concern, and Michelle, you and I did work this out, but I just wanted to bring it to the attention of the group. So when the Prestige facilities were reorganized into the PACS facilities, the post-acute care, it's I term it as sort of like a franchise. And so what happened with that change of ownership, it's called a chow, And what happened was all of the prestige facilities that had prohibition letters then were released from the prohibition letters and were given sort of a clean slate moving forward. And that was last year at some point. I can't remember. It was at least a year ago, maybe even last year in the summer or fall. So recently, I had put through an application for one of the PACS facilities and it was denied, and it was said that they were on prohibition. And so I got a hold of the Board of Nursing, and my email, of course, went to Michelle. And Michelle looked into it and found that DHS did not do their job in releasing that facility from the prohibition letter that was in place when it was a prestige facility. And I'm just wondering, is there a system now where DHS can go through and check those facilities? Because if it happened to one, it could be happening to others. And have any of you guys had any problems with the change of ownership from the Prestige to the PACS facilities in regards to having a prohibition letter on that facility from prior to the change of ownership?
I'll share, Julie. Thank you so much for bringing that forward. It was an opportunity for us, for myself, to really dive in a little bit with our ODHS partners. I'm not sure it was a failure of them doing their jobs, but what I discovered was, I guess at the federal level, they have just transitioned to a different platform that they're using. And so whenever you do data migration, there can be errors. So that's sort of was the source of that oversight. But finding that sort of triggered them to, I hope, prioritize cleaning up that information and double checking and making sure that as that data migration happened, there aren't other facilities that fell through the cracks like that, but it's a possibility. So if you are finding that, or you, not just the PACS facilities, but others. So please bring it to our attention if you suspect or know that someone is being denied that shouldn't be, and we'll partner back with them to get that fixed. Yeah. It's complicated over there, the flow of information and storage of information. All right, folks. What else? I'm not going to meet with you again until January, and I hope by January I will have a much stronger handle on all the complexities involved in this work and the best ways to support you. And I want you to know that I'm absolutely an open door. So reach out. There may be things I can't quite answer yet, as I'm still wrapping my head around a lot of it, but I think just knowing where your wheels are spinning will help me understand where I need to put my effort as well. Julie.
Yeah, I just have one more brief question. So are you going to be utilizing your own email, or are we supposed to still send our emails through the policies email to get them to you?
The policy email has multiple eyes on it. So if I'm away from the office or Selena's away from the office, we still have folks or Indico looking at that. So I think that, are you seeing the slide with with our contact information? Did it come up? Is it showing board updates? Sorry, I mean, get up there. Are you seeing
there it is?
Okay. So the policy inbox, I would say, is the preferred method of communication because I think someone is going to get to you more quickly. But certainly if you want to reach out to me directly because you have a question, that's fine. I'm not saying don't do that. And then Selena is available as well. But both of us are on that policy team email as well as others. So I'd say for general questions, I'd start there with the policy email. But if it's a conversation that you and I are continuing, please, reach out to me directly. I've been working to, create lists with all your programs, your contact information, notes about your program. There's a lot of programs between the NA and MA programs, so just bear with me as I learn all of you and your programs and the nuances and locations, and I'll be asking lots of questions of you for a while, I'm sure. I'm excited. I'm excited about this work. I'm excited about the work that you guys are doing. I think this is, really a burgeoning, with so many changes in nursing staffing, nursing shortages, relying on our assistants and med aides is going to be, it's just growing, right? You all know that. So we want to make sure that we're supporting you to grow, to meet that need. So that the health of our organ population is as optimal as we can keep it, because CNAs and MAs are critical in that space. All right, folks. Well, we're coming up on a little after 10:20, so last call for any questions. All right, I'll let you get back to your days and all that great work you're doing out there. And thank you so much for being here with me today.
Nice to meet you. Welcome.
Thank you.
Yes,
Thank
welcome.
you.
Thank you, everybody. Bye.
Thank you. Bye.
Thanks all.
Hey, Michelle.
Yeah.
Do you have just a few minutes?
Sure.
Okay.
You want to call me separately so we're not on the public call?
Sure, absolutely.
Yeah. Just ping me.
Okay.
Thanks.